I'm Dr. Michael Miyasaki. Thank you for joining the program once more. And today we are going to continue our conversation about the importance of endodontic irrigation. Now, why is it so important? We've talked about this during our previous sessions, was when we find those main canals, sometimes as we're cleaning those main canals, our instruments don't really clean the total canal space, and we have all those lateral spaces that we have to clean. And if we don't get all the bacteria out or we leave some tissue behind, there's a good chance that we're going to finish that root canal up and the patient's not going to heal up right and they're going to have discomfort and pain. And we don't want our patients to experience that. So we've got our new endodontic file systems and we can get in there very efficiently, but we have to make sure that we use irrigation to really disinfect and the canal system and dissolve the tissue that we've left behind with our files. So really it is the action of our irrigants that helps us succeed when we're doing a root canal, but we have to use irrigants, I think, that keep up with the speed of our new file systems. So I discussed this before, is that when I used to do my hand filing, it would take me an hour and a half to do a molar root canal, and today it could take a fraction of that, maybe 20 minutes, because the rotary file systems are just so quick and easy to use. Well, because it goes so fast, our irrigants don't have the time to work. And so that's why we have these really advanced, enhanced irrigants, and that's what I'm going to cover today. And I'm really excited to bring this information to you. Now, one of the things that I think is really important as we talk about irrigants is the use of a rubber dam. It's a standard of care when we do a root canal, and yet there's many dentists that don't use a rubber dam when doing a root canal. And it's just very dangerous for us to do that. Why? Well, because we're using a lot of small instruments like endo files that could slip out of our fingers and be swallowed or aspirated. We don't want that to happen. We want to keep the bacteria out of that root canal system that we're working on, and a rubber dam is really good to do that, to keep the saliva from going down into that canal system, because remember, we're trying to get rid of the bacteria. We don't want to reintroduce more bacteria. And so as we get that done, we've got the rubber dam to protect that area, to isolate it, to keep our files out of the patient's throat or lungs. But we don't want the patients to have to taste our irrigants. These irrigants, they're not very tasty, such as bleach, right? Do we squirt bleach in our mouth for fun? No, we don't want to do that. So let's do everything we can to keep our patients safe and to keep them comfortable. And I think a rubber dam comes in very handy for that. Now, one of the things that I do is I find it easier to put the rubber dam on once I've done my access. So at the access point, I haven't necessarily used a lot of files. And if I'm going to use maybe a 10 file, wrap a piece of floss around it to make sure it doesn't slip down and go down the patient's throat or worse. So make sure that you can locate the canal system. Now, the way that I do it is I will numb the patient up, and when they're nice and numb, I'll go ahead and do my access. Now the instrument is just a drill, so I'm doing my access opening, and I make sure I find the canals. Now, once I pop into the chamber, hopefully the patient's comfortable, but if they're not, then I don't have to worry about a rubber dam. I can just add more anesthetic, however in an appropriate way we need to do that to make sure that our patients are comfortable. If I had the rubber dam on, it's just much harder. I've got to take a flap of rubber dam, get that out of the way, and then administer more anesthetic. So I like to be sure that I have good anesthesia before I put the rubber dam on. And now another thing is the orientation of the tooth. I just did a root canal last week where the tooth was rotated about 30 or 40 degrees. And so for me, being able to see the root, because the crown, it had a crown on it, so the crown looked like it was oriented as a tooth should be, but the root I could tell was at an angle. And so without a rubber dam there, I could see the root and I could do my access opening without worrying about perforating the root, because if I had gone where I thought the canal would be, well, it's truly over here, and if I went into that first area, there's a good chance I would have perforated the root, which I wouldn't want to do either. So many times, once I have my access opening, and so now I know the patient's numbed up, and I'll use my Endo Explorer to kind of get into the canal spaces to make sure I have that, so I don't even have to take an endodontic file into the patient's mouth. Now I put the rubber dam on. With the rubber dam on, I've isolated that area very, very well, so I don't have to worry about a file slipping and going into the posterior areas of the patient's mouth, and I don't have to worry about them tasting sodium hypochlorite. So we have the rubber dam. Now, I mentioned this before that we want to use a sodium hypochlorite that is pharmacy grade. And then why not just over the counter? Because an over the counter sodium hypochlorite, we don't know the exact concentration of the sodium hypochlorite. Sodium hypochlorite naturally degrades due to exposure to light, oxygen, heat, and metals. So I live in California. If the if it's summertime and the truck that's transporting the sodium hypochlorite has extreme heat, because a lot of times we're 100 plus degrees in the summer, and there's a lot of light that hits the bottles, that higher concentration of sodium hypochlorite, that's maybe 7% in my Clorox bottle, by the time it gets to the store shelves and sits there for a year, it could be down to, who knows, 2%. And now if I dilute that 50%, instead of using a 3 or 6%, I'm down to 1%, which may not provide enough action to dissolve the pulpal tissue. So when we use a pharmacy grade type of, let me just get this going. When we use a pharmacy grade type of sodium hypochlorite, we know what the concentration is. It has a shelf life. After that shelf life date, I want to discard the solution because I don't know exactly what the concentration is going to be. So it has a quality control behind it. So I know when I put that in the canal system, we're going to dissolve the tissue in that canal system. And it is intended for the clinical use in the treatment of endodontic lesions. So I want it to be indicated for use for root canals, right? Not to get my clothes whiter. So I think that's a very important part of what we do and why we use a pharmacy grade hypochlorite. And then our ethylene diamine tetraacetic acid, research shows that the pH is more important than the concentration. So the Vista Apex EDTA is optimized at that pH because the optimal pH is between 7.5 and 9, and our Vista Apex has a pH level of 8.5. So the Vista Apex EDTA 8.5 is going to remove the smear layer and the dent mud much more efficiently. Now, when we remove that dent mud, we open the dental tubules so that we can re-irrigate with sodium hypochlorite now and get into all these lateral spaces. So here you see there's a bunch of mud over the tubules. You can't see the tubules, but after applying the EDTA, now everything's open. Now imagine any bacteria in these little tubules. When we rinse this out again with sodium hypochlorite, they're going to be decimated. They're going to be wiped out. And then many of our colleagues like to use a chlorhexidine rinse. It's a broad spectrum type of solution that will kill the bacteria. So the 2% chlorhexidine gluconate solution that is more pharmacy grade is very important to use. Now, Vista Apex is a leader in endodontic irrigation, providing innovative solutions that allow clinicians to thoroughly cleanse even the most difficult canal anatomies. And because they have an enhanced line of irrigants, pairing with what we'll cover during the next session, ultrasonic activation, it simplifies the system, makes it safer, and less of an inventory is needed. So with these optimized irrigants, what am I talking about? They are enhanced because they have surfactants that have been developed. These surfactants allow these solutions to penetrate into tissue and into spaces much easier, and I think that's important. What is a surfactant? A surfactant is like an emulsifier. So if I take water and oil and I mix them together and I shake them up, guess what? The water and the oil never combine, they never mix. But if we add something like an emulsifier like detergent, what will happen is that they'll combine because the surface tension between the two different liquids is reduced so that they now can combine and make contact. So imagine this, we put an irrigant in a canal system, and let's say there's dental mud or there's pulpal tissue there. Well, this solution has to penetrate into those tissues and into that mud. The surfactants are going to allow this to happen much easier. So we've got the pharmacy sodium hypochlorite, we've got the EDTA with an optimized pH, but now we have the Chlor Extra, which is a sodium hypochlorite that's enhanced with these surface modifiers. We have the chlorhexidine CHX plus that's enhanced. So it too will be faster acting. And we have Smear Off 2-in-1. So it is basically the equivalent of EDTA and chlorhexidine and it's going to work faster and better as we do our root canal. So again, surfactants are chemical compounds that decrease the surface tension between two liquids and allow them to mix. And I think this is a very important property. So what I'm going to show you is a video, and in this video what I've done is I've taken a liquid on the outside and added food dye to the very middle. What you'll see is the surface tensions are such that the food dye doesn't spread out. But if I add an emulsifier, and in this case I'm adding just a little bit of detergent, and that is allowing the surface tension to be decreased, and that food dye will just explode out into the surrounding liquid where before it had no interaction at all. So there's our liquid. I'm adding just 1 drop of food dye. And if we touch that dye, it will do nothing because there's still surface tension on the outer border of that food dye. But if I add something like a surfactant that decreases the surface tension, and in this case it's just a little bit of detergent, and we add that to the food dye, look what happens. It's like boom. And that is the cool thing about decreasing the surface tension. When we do that, now the two liquids actually combine. So imagine if we had those same types of surface modifiers and we put that in our irrigating solutions and we had better interaction, how much better that would be. And I've shown you this video before. This is my hemostatic agent of choice. It's quickstat free. It's a clear hemostatic agent. It doesn't it's not ferric based, so it's not going to turn this tissue brown, especially when we're working the anterior area. But look at how efficiently this works. Now, I'm not really scrubbing it. I'm just applying it to the broken blood vessels. And because the quickstat free has surfactants in it, it can penetrate into those broken blood vessels. And look at, we rinse that off and there's no bleeding at all. Now, it's the only aluminum chloride that I have ever used that was that effective. But let's talk about the irrigants again. So the Chlor Extra is a 6% sodium hypochlorite. It has the powerful wetting agents, the proprietary surface modifiers that allow it to penetrate into lateral canals and isthmuses by lowering the surface tension. And this way, we reduce our post-treatment complications, as I mentioned before, because we're getting the good clean of our canal systems. Because it improves the contact with the tissue around it, it can dissolve more tissue, increases the lubrication it can deliver because of that. And so when we look at the ADA did some testing, and here this is a graph of the surface tension, and what we want to do is we want it to be very low because that's just showing that by using Chlor Extra we can reduce the surface tension. Now, what does that lead to? Well, this was done by the ADA product review again, and it's just showing that the amount of tissue dissolution that we get is higher when we use Chlor Extra than when we use other irrigants. Now, why is that important? Well, that lower surface tension allows better interaction. The better interaction allows more action, and we dissolve more tissue, we get rid of more bacteria. So compared to standard sodium hypochlorite, the Chlor Extra offers greater oxidizing power. It's got more wettability, and because of that, it is more digestive. It works faster because we have less surface tension. So by changing to Chlor Extra from regular sodium hypochlorite, and again, I hope you're not using bleach anymore because we've covered that. Watch how much faster this dissolves tissue. So on the left-hand side, we have 6% sodium hypochlorite. On the right-hand side, we have 6% Chlor Extra. We have similar tissue samples, but look at how on the right-hand side, we are able to dissolve that tissue so much faster. So right here, we're at 20 seconds, and the tissue on the right-hand side is almost gone. Now we're getting up to 25 seconds, just a little bit more tissue, and right around 30 seconds, we're done. Now on the left-hand side, it looks like we're about 50%, maybe 40% of that tissue is left, but definitely it's taking twice as long to dissolve that tissue that we have on the left-hand side than it took on the right-hand side. So just like anything, when we're working in our dental practice, that extra time, maybe it's only 30 seconds, but it seems like 5 or 10 minutes. So at the 1 minute mark, there's still tissue there with the 6% sodium hypochlorite, and the 6% Chlor Extra has done its job. So I think that's a very important message because remember, our files are just going so much faster now. that when we irrigate that root canal system, we want our irrigants to work really, really fast. Now, the second solution we can use is called smear off, and it is a two-in-one. Remember, it's our EDTA and our chlorhexidine with the special surface modifiers or wetting agents. So it's going to optimize the smear layer removal. But another important thing is you don't have to rinse between using your sodium hypochlorite or your chlor extra and your smear off. Because remember, when we had sodium hypochlorite and we had our chlorhexidine, we didn't want to mix those two because we would get that brown precipitate. So now what happens is we won't get that, and that's very important. But we do lower the surface tension, so we're going to get much faster acting dissolution of the inorganic debris and get better chelation. So this is just showing how Smear Off 2-in-1 is a proprietary EDTA chlorhexidine mix. It replaces both. So instead of having 3 bottles, let's say you had your sodium hypochlorite, you have your EDTA and your chlorhexidine. Now you're just down to something like Chlor Extra and Smear Off 2-in-1. The great thing about this is you don't have to do that additional rinse step between your sodium hypochlorite and use to smear off because you won't create that perchloroaniline. And so it's safer, it's faster, it's effective. Why would you want to use anything else? So again, in the studies here, just showing the open tubule percentage. So, the removal of the smear layer gives you more open tubules, and the purple bars are the smear off, and how it does in the coronal third, in the middle third, how it's very close, and the apical third, in the coronal and apical thirds especially, it was head and shoulders above any of the competing materials or irrigants. And what was in the middle third, what was second best? It was Vista Apex straight EDTA. But in the coronal and the apical areas, the smear off did as well or better, basically. So this is just an article that shows that if you have sodium hypochlorite and using chlorhexidine, now when you use smear off and sodium hypochlorite on the dent surface, we did not get a formation of any kind of precipitate. So I just wanted to explain that to you, that we don't have that worry now. Now the chlorhexidine or CHX plus with those surface modifiers actually has better kills. So on the bottom graph on the lower left hand side, wherever you see red, that shows bacterial kill. The right shows where it's green, more green, that shows that there's more bacteria still thriving. So by using CHX plus that has the surface modifiers, it is actually killing the bacteria faster and better than chlorhexidine. So here are some studies just showing that CHX plus, which is the red bar, compared to your regular chlorhexidine, at the 0 time right here, we've got 100% bacterial count. 10 seconds in, CHX plus has a level below the detection limit. You see by the green dotted line. The regular chlorhexidine takes about 3 minutes to get below the detection limit. So that's very important, because 3 minutes is more than most of us will irrigate with chlorhexidine. 10 seconds, we do that, 30 seconds, 60 seconds, we're probably more in that range. But most of us aren't going to take 3 minutes to irrigate with chlorhexidine. So it's just a very important part of this research showing that it is CHX plus with the surface modifiers. It's just so much quicker. It's just better for us to use. One of the questions I get is, should we use water to irrigate in between? And I don't think it is bad to do that. So here's sodium hypochlorite. We're putting in these wells here. And on the left-hand side, I'm going to take the sodium hypochlorite and add some chlorhexidine. And what do we expect to happen? We would expect to get that precipitation occur with the brownish red color, and we want to avoid that, because one, this can discolor our tooth, and two, research shows that could potentially be carcinogenic. Now in the right hand well, we're placing the sodium hypochlorite with some EDTA, and there's really no reaction. There can be some salt formation, but there's no reaction with discoloration or anything like that. On this far right hand well, we put some EDTA in there with some chlorhexidine just to show that with that we don't have a reaction. So you can see that with the sodium hypochlorite and the chlorhexidine, we do get that precipitate. You can see how it looks like there's little particles in there, and we don't want that to happen. So we don't want to mix those two together. Now here is sodium hypochlorite with the smear off. So as we mentioned before, with smear off, we shouldn't, although it has the chlorhexidine action in it, we should not have any kind of precipitate formed. So there goes our smear off, and now we're adding the sodium hypochlorite, and you can see that solution stayed clear. There was no reaction between those two. So by using smear off and our chlor extra as our sodium hypochlorite, that was very safe, it was very fast, and it's actually more effective. So it's hard for me to understand why it's so hard to convince people that all they have to use is the chlor extra, which is your sodium hypochlorite, and smear off, which is now your EDTA and your chlorhexidine. You don't have to worry about mixing the two, so it's safer. It's going to be faster. There's less inventory, and the research shows that the combination of these solutions is just more effective. And when we talk about how to deliver these solutions, instead of having a lot of different irrigation tips, we now have one tip. It's called the Voyager or the VIP Irrigating tip. It's got a stainless steel shoulder, so it's very easy to bend. It's very easy to extrude the irrigant from this needle. It's got the lure lock attachment to attach to your favorite type of syringe, but it has dual side ports. And so the dual side ports, again, will reduce the amount of pressure you need to irrigate, but it'll help prevent any kind of apical injury because the end is sealed up, so the solution can only go out sideways. It's got the silicone stopper, so when I pull it out, let's say I want to irrigate down to 17 millimeters, I can measure to 17 with the stopper and know how deep I'm going down to that canal system. So it's got the dual side ports. It's a 29 gauge needle, so it can work its way down into even the narrowest canals. Comes in two lengths, 17 and 27 millimeters. It's just great to make your inventory smaller. And we all know what we're trying to avoid. This is the poor woman that had the sodium hypochlorite accident. And again, what happens is when we're putting our sodium hypochlorite into our canal, we jam it up with an end dispensing needle, and we express too hard, and it goes beyond the apex of the tooth, and it gets into the soft tissue, and we end up with this kind of reaction, and we don't want this for our patients. Now, one last delivery needle suggestion is at Vista Apex, we have 6 cc dripless syringes, because we have patients today that will come into our office and they're just very nice. And I don't know, I think we've all had this happen where we pull out our sodium hypochlorite and there's just a drop of our bleach hits the patient's shirt. And they've got this nice dress shirt, and now we've discolored it because we have a bleach stain on it. By using a dripless syringe, it's just like our anesthetic needles when we had that drawback. It's just automatic. When we're done expressing our irrigant into the root canal space and we release it, this just kind of sucks back the little excess at our tip so it won't drip on our patient's clothing and we won't have an accident. So we do have these dripless syringes that work really, really very well. And so that brings us to the end of this session. I hope you like this information. I try to keep it moving fairly fast, but we are trying to create this community of like-minded individuals trying to do the best dentistry that they can. And if you like this, please subscribe so that you're notified and won't miss our future episodes coming up. If you like it, hit like. And if you really like it, share it with a friend, because this is great information. Doing what you're doing already to have successful root canals, but just doing it more efficiently and having greater success. What could be better than that? So I hope you enjoyed the information. I hope that you implement it with the Chlor Extra and the Smear Off, with the dual side port Voyager VIP tips and the dripless syringes. So very easy implementation, and I look forward to seeing you during our next episode. Thank you very much.